Happy birthday, ABB! A little over a year ago, an amazing human, Mel, told me about her dream, a place where everyone could come just as they are, a safe haven that would be full of magic, and together we dreamed up the name, All Brains Belong.
When you really think about it, All Brains Belong is a pretty radical idea. The idea that we would no longer make a distinction between healthcare and the rest of life, where we would recognize that health and connection were not only related, but that connection and belonging were fundamentally required for health.
Welcome to All Brains Belong, Vermont. It's a kind of an interesting place because it is a doctor's office, even though it doesn't really look like a doctor's office. And it's also where people can make friends who like the same stuff that they like.
And I had pretty much exhausted mainstream healthcare options, or at least the mainstream healthcare options I was willing to try. And I heard this, I was sitting with this friend over coffee, who was the director of the Vermont Disability Council, and she was raving about this new doctor in Montpelier who was out as autistic and starting a medical practice.
I knew how to be a doctor, but I did not know how to start a nonprofit, run a nonprofit, run a medical practice. But what I did know is that in order to make an impact and improve the lives of neurodivergent people, you had to change the world. So, to do anything for the neurodivergent community, you had to do everything. It's not just healthcare. It's loneliness. It's school. It's work. It's everything.
Qualitatively, the experience at ABB is really different and really sincere attempt, the most sincerest attempt I've ever seen in a medical practice to meet people where they are at, to serve everybody well and to leave nobody behind. It's an incredible effort to make groups and meetings and medical care accessible and interpersonally, practically, financially.
I raised enough money to pay a couple months rent and buy some insurance. And so then I just started seeing patients in an office by myself. The day before we opened, we didn't have any furniture. So I posted on Front Porch Forum. Someone offered a recliner. Well, you gotta start somewhere. So I go pick up the recliner. I tell the person what I'm up to, and she's like, "Oh, you need to come with me." And we drove across town to where her sister had lived, and her sister had just passed away. My sister would love what you were doing. And she and her family loaded up all this stuff in their trucks, and they drove back to Montpelier with me to our office. I sent text messages to everyone I knew who can help unload a whole house full of furniture. When? Now. And that was our move-in story to our first office at 250 Main Street, Montpelier.
This is my exam room. It does not look like a doctor's office, at least I don't think. This is where I sit, and there's lots of different chairs to pick from, a whole bunch of books. When you come in, you can just check stuff out and see if there's anything interesting to you. So one thing that's really interesting about this place is that people gave us trees. There's literally trees in the waiting room. What?
We are in Mel's office.
Isaac was feeling really brave, and we came to have the stitches removed.
And I'll show you around. Here is a space tent. I'm gonna go inside. Oh, and there's this inside. Ooh. Oh, and a giant Pluto.
Hey, what's your favorite music? Gonna put background music on?
My favorite music is Banana Phone.
Oh my gosh, I love Banana Phone so much. Okay.
Tongues out.
Can I do what it looks like?
Totally. You want to keep it like a souvenir? So before we launched, my board of directors was like, Mel, yeah, I can't do all the things. My PDA raged. Like, just watch me. But those first few months were intense. Like, in the office till 4 a.m. all every night. Turns out, it's pretty hard to do all the things. I had foot on the gas. I was also tempted to do one more thing, to check the box and be done, but like, I really want to get home and see my sweet little love.
What I really was amazed about was when I was looking for somebody up here, then it's All Brains Belong. I was like reading the website, so like, oh, this sounds pretty good. And then when I started filling out the forms, I was like, wow, this is exactly the kind of thing I'm looking for. And then I sent you my mind maps and my emails, and I think other doctors would have been just overwhelmed. But instead, you were like, oh, this is so cool. This is so helpful.
When I was sitting in the waiting room for my first appointment, there was this a really short book written for kids, and it basically told my life story of losing it. I mean, I remember reading it, waiting for my first appointment, so sort of losing it and having these public meltdowns that I was so ashamed of, and it explained those things in terms of the fight-flight response. It looks like these people speak my language.
I think one of our first game changers was the decision to hold a neuro-inclusive COVID vaccine clinic, open to the whole community, and within our first couple of weeks of launching. This was a chance for the general public to see how truly simple this radical concept really was.
So, we all have different brains that think, learn, communicate, do things differently. And yet many things in society have defaults, and vaccination clinic is an example where the default thing is to get your vaccine in a crowded, large group environment. But for many brains, that does not feel comfortable. So when we say inclusive, that's you feel like you belong. So neuro-inclusive is that everything we do, we design to be accessible, comfortable, and engaging for people with all different types of brains.
So who best benefits from this type of a vaccination clinic?
Everyone. We offer a customized experience. It's not cookie cuttered. It's a unique, separate workflow for every person, and everyone benefits from that.
We had kids who traveled from all over the state, some on their fourth or even fifth attempt at accessing vaccination. And while many were able to access vaccination, some were not. And we still wanted to support families in reframing.
We can, even if kids are not able to receive vaccination because the limbic system says no, I think it's reframing what success is. Yeah. Success is not always just getting the vaccine. Success is, wow, you recognized when you didn't feel safe and you honored your internalized signal of threat. Like, isn't that what we want? It's a good thing when people have a positive healthcare experience. Like defining like the connection of, I formed some sort of memory that wasn't awful.
The more that pattern goes, right? Those neurons that fire together, the more they do that, the more that pathway is accessible and has ease. There's no ease in that pathway for a lot of our nervous systems right now because there has been no autonomy, because there's been no agency, there's been no freedom and choice.
We realized we had to start talking about these concepts. We had to give people language for their experiences. And that was how Brain Club was born.
Welcome, everybody. Welcome to Brain Club.
Brain Club is like a great innovation and like open to the public and a chance for like, a robust discussion about bringing the spectrum of life issues.
So without further ado, let's talk about some lid flipping.
Flips their lid once.
Yeah, or twice, or like a million times.
400 million
400 million times. Mm-hmm. Did you know that some people think that they're the only ones who flip their lid? Did you know that?
No.
Oh. Some people think they're the only ones, and then they feel bad about themselves because they think they're the only one.
A lot of people over a long time have said, oh, we need this, or oh, we need that. And nobody had the energy and the skill together to do it. And then I met Mel and she had both, and it's just been wonderful.
I have been volunteering with All Brains Belong since its very beginning. My kids also participate in some of the virtual community programs. All my life, I felt broken, lost, and like a failure, always thinking I was too much, hating myself, and wondering how others did life so easily.
When we tell Sweet Little Loves that the way that we are intuitively feeling in our bodies is wrong because there's a just so way to be, what do we expect is going to happen?
When I realized I was an autistic ADHDer, I finally felt whole and loved myself for the first time in my life. ABB's resources and community have helped me bloom into my true self and made me feel like I finally truly belong.
I just recently got my autism and my ADHD diagnosis, and since then, my entire life has changed, to be honest. Prior to this, I didn't realize that a lot of the struggles I was having in my day-to-day life were pretty much all connected to autism.
I was looking for a community of like-minded individuals so that I could share my experiences and learn, and I have found that in All Brains Belong. I'm really enjoying going to the weekly Brain Club meetings and talking with other people that are neurodivergent, and also particularly our parents.
Behaviors, things we can observe that communicate someone's underlying physiologic state.
I'm learning new strategies on how to communicate better for my kids and advocate for my children in school systems.
While all of our programs here come based on feedback from our community advisory boards, probably the best ideas around here come from kids.
I said, hey, Seamus, how do you think we can make kids feel like they belong? And without any hesitation, this sweet little love says, you just let them do what they love. That's it? Turns out, yeah, that's it. So we started bringing kids together based on shared interests.
Stuffy night. And I was there to help with the kids because, that's great. But then there was also like adults. I could have a stuffy night with adults. I have a stuffed coffee cup.
I love that.
Okay, I have a stuffed coffee cup and it's okay.
Now, meanwhile, our healthcare practice was getting busy. We filled up in the first couple months, and fortunately, in March 2022, Sierra Miller, nurse practitioner, joined our team, and best thing to ever happen to ABB. And her passion and expertise in caring for people with all types of brains and bodies has really allowed us to move into our current chapter of our healthcare practice. Sierra and I, we packed up our stuff. We moved down the block to our current home at 138 Main Street.
Also, it really matters to me that the practices like GLBTQX affirming, Sarah is doing so much work with that and was hired, really as a statement of that and in support of that. The practice is really developed in consultation with patients, and like we're in these advisory groups and invited to join them and that.
What I appreciate about All Brains Belong is how they really take care of their patients, considering all aspects of health, mental, emotional, and physical, and also how the providers are willing to think out of the box.
your organization has broken so many of the brain rules that I've seen in healthcare.
How the practice develops is informed and driven by what we say in those meetings, and basically informed and driven by patient needs.
So I knew a lot about autistic health when we launched, but I'd say the biggest surprise of the past year has been all the things.
So, by way of introduction, we have a pattern here, as many of you know. More than 70% of our practice has this constellation of autoimmune, connective tissue, and neurovascular differences that are resulting in significant disability.
It's like Google Maps when you're zoomed in so far you don't even know what continent you're on. You gotta zoom way out to see the big system of everything being connected to everything.
Autistic people are at a higher risk of developing complications from COVID-19. In this week's Health Watch, our Christina Gesford sits down with a doctor who says she's witnessing the pattern firsthand.
Dr. Melissa Hauser opened her nonprofit All Brains Belong a little less than a year ago in the middle of the pandemic right here in Montpelier.
It is well established in the literature that neurodivergent patients have more autoimmune disease. Often, they may not be symptomatic until their autoimmune disease gets triggered.
And COVID-19 can be one of those triggers. Many scientists believe long COVID is an autoimmune response to the virus in which the body attacks itself.
Mel's like amazingly gifted at pulling together amazingly gifted healthcare professionals who have tons of expertise in particular areas, and they also seem like incredible human beings. So it's like, oh wow, I want to listen to these people and hear what they have to say, and then they talk about like issues of concern to the autism / neurodiversity community, and they get to share what they've learned. They problem solve together, and it's really fun to be able to see those discussions and learn from the discussions.
For example, if somebody has chronic pain, they often get put on muscle relaxants, which if they also have sleep apnea, because connective tissue is collapsing on itself in the airway, that's going to make this worse. And then you're going to have more hypoxia, which then makes your blood vessels tighter, which then it all disintegrates from there.
And then this is just like so amazing to me. There are these amazing group medical visits where Mel and Sierra offer this cutting edge information, but they also allow lots of time for questions and in-depth discussion around areas the areas that concern us. And and beyond that, and there's more, because there's also an opportunity to meet others in the community who are going through the same or similar things, which then gives us the opportunity to learn from each other's experiences and to really value and feel valued by each other and feel a lot less alone and a lot more hopeful. And so it ends up feeling like a community more than a medical practice, which is something that personally I'm really hungry for, and it seems like a lot of the people in groups are also hungry for.
In June, something else really amazing happened. Sarah Wilkins happened. So Sarah joined our team first as our coordinator of our Kid Connections program, and then as our volunteer coordinator, and now in the role of community programs coordinator. And Sarah brings passion and wisdom and executive functioning.
What interests me about All Brains Belong is the idea of a customizable menu to make an experience, whether it's a vaccine clinic or a medical visit in the office or a community gathering event, feel good to each unique individual. And everybody shows up and can be 100% themselves.
So because we are still in the middle of the COVID pandemic, particularly supporting a community that is at increased risk of complications from COVID, we had to step up our community program game to reimagine what good hybrid programming could look like. And Sarah has helped us do that.
It's easier in the world we live in to modify the child than it is the environment. I'd just like people to know that really just lead with what you value, lead with kindness. And when a kid comes to you and they can't explain what's happening in their experience and you can't understand it, don't think automatically that it's a problem with them. Find somebody to give you another point of view on what's happening for them. And that way they can move through life based on what they're good at and what they love. And that's where all the good parts of human development come from.
And ultimately, I feel like I have found a community that does understand what I'm going through and the challenges that I face on a day-to-day level. And it has given me a great perspective and an ability to allow myself more space and ease in my daily life and open up new areas for support that I really could have used all along. And it has just taken the frame of reference for my life and shifted it and allowed so many things to just make sense about my past and about when I was a child, and just give myself a lot of grace and ultimately just translate that outward to my children and other members of my community.
It's just like amazing and blows my mind that ABB is working on has taken the initiative to work on creating employment opportunities for people in the neurodiversity community. That is like so fundamentally connected to my perception of health and well-being. It makes me feel like I have a future.
People want to talk about work. They wanted to talk about specifically how their workplaces were not working for their brains. And so the Neuro-Inclusive Employment Task Force was born. And from this came brain clubs and trainings. We call it Neuro DEI because, like it or not, neurodiversity and access are largely missing from the community conversations on diversity, equity, and inclusion. Till now.
I work with lots of people who are neurodivergent of all ages. But it's still that mentality of we're going to try and fix it to be normal. So to have a place where I'm not masking and I'm not acting and I'm not spending over half of my mental energy trying to figure out what they expect from me. No, I don't have that anywhere else.
And then there's this, and then also, can you believe it? There's also this, and yeah. I mean, I guess the other thing that I didn't mention quite enough is like, I just really, I mean, ABB is sort of like, there is this kind of social justice, like this isn't a problem. You are not the problem. The problem, we have a world that needs changing. And I love that the approach is, instead of like forcing people to change or like getting in people's face about change, the approach is just to show people that it can be done and do it really well. And that, I just think that's just such a beautiful model and a beautiful way of like, just a beautiful way of it's like creating the world you want to live in. And anyway, I think that's inspiring.
I think that this about being, about accepting, about inclusion, and everybody gets to have needs and everybody's needs deserve to be met is what is going to make this actually stick.
And then probably what was one of my most memorable days of the year was this past August, our community health education fair at the State House lawn. It was truly a culmination of all that has gone into this year.
And when we really think about community
We think about bringing people together based on shared values and a shared vision of what's possible. We're bringing everyone together to celebrate the coming together of this community and reimagining systems of health, employment, education, and really community. Because healthcare is community.
I do feel like I finally have found my tribe and a place where I can be myself and not have to try so hard to belong.
It makes me feel so much less alone and also judge myself so much less. It's like, if these amazing people can, be struggling, then not so bad that I am too.
But I never thought we would actually be at a place where we could say, how do we make society fit Emma? And Mel gives me that hope.
So hard to believe it's been a year. And truly, we would not have been able to do this without you, our volunteers, our community members, our patients. Thank you for being part of our village. Thank you for co-ideating, co-regulating, co-creating this beautiful organization that is showing the world what's possible for healthcare and community.
All brains belong.
Yay.
All brains belong.